Stop it. You don't do that. No, you. No. No, you don't have to. Christian down. He's not hurt.
Taco Tuesday. All right, we're gonna have a quick discussion on a patient assessment. So, depending on your emergency, such as this guy limping off the field. Oh. Get to see firsthand, guys.
What is it?
They call me wrong. Okay, let's get you cleaned up.
Oh, you got it?
Yeah, I got it. Come have a seat. All right, boss, what's your full name? How old are you?
13.
13. What school you go to? And do you know what today is?
You gotta cut on it up.
Yeah, we just gotta get your blood cleaned up so when they're playing.
He's gonna burn?
Nah. Do me a favor, go ahead and clean that off for me. All the way up.
Jalen! You're gonna block on the backside, Jalen!
Go ahead and put your arm straight.
Oh, you know why they're not saying this up there? Why? Because take it off. Look. Yes, no, it's not. That's why I'm saying it's not clear. That's your school one?
Hold that for me.
That's how you do it, baby.
All right, good to go, boss.
Hello? Hey, somebody go run in the water. Water. Bro!
Patient assessment. Okay. When you go through any EMS school or paramedic school, there's a standard format that you learn to follow so that your call so that your assessment and the treatment of your patient will be completed in an orderly fashion. If you can see this is just a random one I got. It says State of Indiana EMR Psychomotor Skills Examination. And based off of that, first step would be to take and verbalize appropriate body substance isolation and precautions. as you saw in that little boo-boo there, I did not take BSI precautions by putting on gloves and masks and eye protection, and that's simply due to the environment here. Okay, I had the child wipe down his own wounds, and I kept my distance by keeping gauze in between me and his blood. Scene safety. When you look around here, scene is safe. Okay, there are no threats. Common threats I see here at work is angry parents, kids becoming overly aggressive after the play is over. Once those are addressed, scene safety is secured, I guess. Step 2, mechanism of injury. Mechanism of injury describes how the patient was injured. So here we have to consider fractures, abrasions, concussions, a lot of trauma here with these kids. These kids are only 12 years old and they're bigger than me. So once you determine how the person was injured, you can focus your assessment on that injury while ruling out any other injuries. Step 3, number of patients. Typically, once a patient on this field is injured, everyone would take a knee until I can get to the patient and safely move them off the field. There have been instances where multiple kids get hurt and it becomes a drain on the available resources, which is me. So I'll have to determine which is most severe, quickly assess them, treat them, and move to the next patient.
The ankle.
The ankle?
Yeah.
Right leg.
Hey boss, first things first, look at me. Go ahead, take your mouthpiece out. What's your full name?
Breathe, buddy.
Dwight what?
Dwight.
Okay, how old are you?
12.
What school you go to?
After Sunday.
What's today?
Sunday. No, after Saturday.
Saturday? Alright, it's your right ankle? Excuse me, boss.
Sound like that, coach. Pull the water on you.
You have any pain here? No? Anything down here? A little bit? Alright, tell me where it hurts, okay? Right down there? Okay. I'm gonna take your shoe off, okay? Can I get your support?
Yes, sir.
Alright, I'll hold his ankle. You just want to take your shoe off?
Yep.
Thank you. Alright, can you rotate your ankle for me? How's that feel?
A little better.
A little better? Okay, I'm gonna have you sit up, okay?
You got it right there.
Alright, there. Go ahead, put your legs straight.
Some more, man.
Hey, Dwight. I'm gonna have you push down on my foot, or on my hand, okay? Push. Okay. Pull up. Lift your toes. There you go. So your pain, 0 to 10. 10 is getting your leg chopped off. What number would you give this?
3.
3? All right, you want to try to stand on it? All right. All right, let me see you take a walk.
Walk that
A few steps. Go that way, go that way, go that way. To your left.
You want that ice pack?
How's that feel?
Better.
Good? Okay, good. Stop there. Can you crouch like this?
No.
No? Hurts worse when you put pain on it, or when you put weight on it?
Mm-hmm.
Okay, let's have you walk to the bench. Have you go sit down. Oh, you're way over there, aren't you?
No, let's hold
Okay, yeah, let's go.
Come on. Walk across the field.
See the chicken crouch? Crouch chicken.
This is her.
What's her name?
Banana.
Banana. Hi, Banana. What's his son's name?
Chicken nugget.
Hi, Chicken Nugget.
That's her. That's
What's
her.
that one's name?
Um,
Here comes my chicken army.
and this is, this, her name is Cookie.
Cookie. What about this one?
That's Curious. I don't know what's his name.
Hey, what about this ganda one right here?
That's mine.
What's her name?
Her name.
Strawberry, right?
No. Pizza.
Pizza. Okay. Put your legs neck straight. Cervical spine. Right here. Houses motor functions and respiratory functions. So if those are damaged, then your patient could completely stop breathing or become paralyzed. Alright, I'm going to show you how to hold C-spine. First, you're going to palpate, meaning feel. Make sure that none of the vertebrae are out of line. You're going to hold the base of the neck and the base of the skull, holding the head, and keep everything in line. If there is a suspected C-spine injury, this is now your job. You are here to stay you are going to stay here until further help arrives. If the patient is in pain and moving around, you must verbally instruct them and tell them, don't move, don't shake your head, don't nod yes or no, stay still. And you hold this position until a fire department shows up and they put a C-collar on, and if need be, strap him to a board. Regarding cervical spine injuries are definitely pain in the neck, but also radiating pain throughout the body. Weakness in extremities. So what you do is you have the person grab onto your hands and squeeze. Tell them, hey, watch it, girl. Yeah, you have the person squeeze and tell them, squeeze hard as you can. Try to break my fingers. If their squeeze does not match their typical strength, then they would be considered to have weakness in their arms. Now, when you check their feet or their legs, you have them push on your hands as if they're pushing on a gas pedal, and then lift up with their toes while you while you apply resistance.
Have you called 911 yet?
Earlier, the chief complaint would be a twisted ankle, abrasion to the elbow. In a more serious environment or situation, the patient's chief complaint could be unknown if they're unresponsive, which is why you fall to the next mnemonic of ABCs. Welcome to my office, everyone. Now that we have passed the scene size up, we move on to the ABCs. A standing for airway, through the nose, through the mouth. You have 2 manual maneuvers to open the airway. Head tilt, chin lift, open the airway. Look inside, there's nothing in there, then the airway is considered patent. Or if you suspect that your patient has suffered a cervical injury, you'll do a jaw thrust maneuver, which is 2 thumbs on the cheekbones. Hook your index fingers and under the angle of the jaw, squeeze together, which will lift up the jaw and bring the tongue out of the airway. Both the head tilt chin lift and the jaw thrust maneuver require one person to hold that position in order to keep the airway open. So what first responders use are adjuncts. This is an OPA, come in a variety of sizes. the way you measure these for the person is from earlobe to corner of the mouth. So on this mannequin, if it was anatomically correct, a red would probably fit. In order to insert this, you're going to go in upside down. Let's see, I get a better angle. Upside down and twist around the tongue, and it will sit on the teeth like that. Another airway adjunct is the NPA, which stands for nasopharyngeal airway. This has a beveled end here, which goes towards the septum of the nose. Septum being right down the middle. So what you would do is open the NPA. Use the sterile lube everything up, and the bevel goes towards the septum. So if you can see, if you went in this way, you would go in, straight back, and rotate until it sits in the airway like this. This would allow a patent airway through the nose. In the event that you open the airway and you see secretions, blood, foreign objects in the airway, it will be your job to remove them so that the air can pass from the mouth or nose into the lungs. Head tilt, chin lift. I see secretions in there. I would take a suctioning device such as this. This has an NPA at the end of a 60 ml syringe. Insert until you reach the back of the mouth, and on the way out, suction and turn in a circular motion. If a suctioning device is not available and you open and see secretions in the airway, you will take the patient, roll them, and allow gravity to drain the mouth. A for airway, move on to B for breathing. When you go through the CPR classes, they will tell you to open the airway, look, listen, and feel for breathing. And what that means is you're looking for the chest to rise and fall with each breath. Place your hand here to feel the chest rise, and listen through the mouth and nose for airway movement. If someone is not breathing, you're going to need to breathe for them. After having put in an OPA or an NPA or an iGel, the airway is clear, the airway is patent, you're going to take your CPR mask, or in this case a BVM, stands for bag valve mask. Place the bridge of the nose first, the bottom half under the mouth, making sure it's sized appropriately. And you're going to do a CE grip. Okay, C with your thumb and index finger, E with the rest of them. The C holds a tight seal on the face mask. E grasps under the jaw to help assist in the head tilt chin lift. And you ventilate once every 5 to 6 seconds. 3 seconds in, 3 seconds out. And you're going to be watching for rise and fall of the chest. Be careful not to overinflate, or you may cause trauma to the lungs. Now we move on to C for circulation. If you have an unresponsive person, you're going to check their carotid pulse. If you find the angle of the jaw, just under the angle, 2 fingers pressed and feel. If you do not feel a pulse, then begin compressions. When checking for a pulse on an infant or a child, small child, primarily an infant, you'll want to check the brachial pulse. Brachial pulse is on the inside of the bicep, right along here. So you use 2 fingers, push and feel. If you do not feel a pulse, then compressions are indicated. After you've checked for circulation, you'll need to make your transport decision, whether you have 911 on the way or you'll need to lift the patient up into your car and go to the nearest hospital. That decision needs to be made now and action must be taken. So now that we've covered A for airway, B for breathing, C for circulation, you need to understand that the primary assessment is looking for life threats. So life threats during the A portion, airway, if you see anything in the mouth, bleeding, spit, vomit, whatever, that is occluding the airway. So you must address that life threat. When they're breathing, if you notice that there is paradoxal movement, or when you inflate their lungs, only one side rises, you should consider that there might be a pneumothorax and one lung is collapsing. So you should check to see if there's any holes in the chest and address that problem. For circulation, you're looking for bleeding, massive amounts of bleeding. If someone has a cut on their face, but it's not going into their airway, that's not a life threat. But if someone has a pool of blood under their body and they don't have a pulse, then you'll need to address that life threat. Just remember, any emergency you come across, best way to stay focused is to follow this format. BSI scene safe, mechanism of injury, how many patients, do you need additional help, and does the patient require C-spine stabilization, what's your general impression of the patient, check the responsiveness with the alert and oriented questions or AVPU. Determine the patient's chief complaint or address any life threats such as arterial bleeding. Ensure that their airway is patent, that they're breathing or you're breathing for them, and that they have a pulse. If not, CPR is indicated. I'd like to say thank you to my sponsors, Range Day Tactical Therapy. Can you see that? Give them a call for any of your Second Amendment needs.